The Central Minnesota Farm Show celebrates its 50th anniversary during 3 days, Tuesday, February 28th through Thursday, March 2nd at the Rivers Edge Convention Center in St. Cloud.
Back once again at the Central Minnesota Farm Show, and I have a guest with me, and let me get your name.
I'm Monica McDonald with the St. Cloud Surgical Center.
Monica, what's your tie-in with the farm show here?
Well, we're here representing, we do total hip, knee, and partial knee replacements on an outpatient basis. So we're here to kind of let farmers know if they have something that they've been putting off. It's a lot quicker recovery time and different things to get them back in farming. We know they're busy. So we brought some of those technologies with us. They are robot-assisted surgeries. So those robots are actually here at the farm show as well.
In healthcare for rural areas, that's a big issue right now.
It certainly is, yes. And we just want farmers to know that as their technology is advanced in their world, so has it in healthcare, which makes it a lot, again, quicker recovery and get them back to work. So.
I bet you'll get a lot of inquiries here and questions.
Yes, we certainly already have this morning. So.
Okay, Monica, thanks for joining us.
Yes, thank you.
You bet. We're here at the Central Minnesota Farm Show.
So, like Cherie is talking about the surgical center, I'm like, well, what's the surgical center have to do with farming? I just didn't get it. What does the surgical center have to do with farming?
That's a very good question.
I bet you know the answer.
Probably not a whole lot of anything, but we can help them make the farmers feel better.
Yeah.
Probably farmers are here trying to make their cows produce better, their machinery produce better, and we're here to make the farmer produce better. I mean, a farmer, if they, got a bad knee, bad hips, we're here to help them out. Yeah. And I think the old conception of after you get a joint replaced and you're laid up for a month, 2 months, 3 months, I mean, that was old medicine. I mean, a lot of times, especially at the surgical center, we're a ambulatory center, meaning that they come in the morning and usually they leave before I do. And so a lot of these joints are walking out. So farmers especially can get back to the lifestyle that they need to have. So which is amazing. Right away. I mean, there is going to be a lapse of time where we don't want them to go out into the cattle barn. I mean, they do have an incision.
Right.
But they're back moving sooner than I think that they know that they can be. And hopefully more pain-free so they can get back to living the lifestyle that they choose to.
Right.
So yeah.
Now there are demands on the farmer, just the farming life, that probably means that the incident of joint replacement is higher, generally speaking, than the general population.
I would not know that answer. You would think. I think farmers are very hardworking individuals. I mean, demands of, bending and lifting and twisting and, all those kind of things. But yeah, I mean, in a census basis, I don't know if professional athletes have bigger joint replacements than farmers do, but we do have rep specialists over here that might know those answers.
Oh, and I will be switching them soon. Have you enjoyed talking with farm people?
I really have. Yeah. I really have. They're hardworking, motivated people who want to get better, and I enjoy talking. I'm kind of a talker, and so are farmers.
I suppose that's true.
They are.
You almost have to be, man. That's a lot of time. You have to fill a lot of time.
Yeah.
You better be able to tell a joke.
And we have heard a few jokes today.
Have you?
They've been good.
Could you tell one to me?
Absolutely not.
Oh, come on. All right, I'll turn that up, and then you will, right? I've got one for you.
Do you?
I've got one for you. I'll trade you back and forth. But we'll wait until
I needed a card, because this gentleman showed us a joke that was actually on a card. So
a playing card?
No. Monica saw it. Maybe we'll see him later today, and I'll send him your way. But it was good.
Okay. Well, what would you like to say to the people that organized the farm show? How about a thanks and congratulations on the 50th anniversary?
Thank you for 50 years of a great farm show. And thanks for including the St. Cloud Surgical Center.
Yes. That's
what
I was fishing for.
Yes, we appreciate it.
All right, Roxanne.
Nice to meet you.
You don't have to turn on the red light.
Okay.
It's already there. Sorry.
Good joke.
Okay, so you must be the specialist, and she's already had her time in the.
No.
You must be the specialist. Let's do two for one.
Yeah.
Sure. You're both good-looking
guys.
Yeah,
right, sure.
You guys are like studs. You
no.
All of a sudden, I feel kind of puny.
No.
Okay. So, are either of you actually, surgeons or physical therapists? What do you do with the surgical center?
No, so we're orthopedic reps that consult with the surgeons on the treatment for their patients, and they ask us questions on implants and positioning, and we help them and assist throughout the procedure.
Okay. Well, what are some of the special needs or conditions that you would say that the farming community has that might be a little bit outside of people who don't do farming? Is there anything that sort of defines the types of services you can provide to farmers?
That's a great question. I guess maybe one of the special needs may be that the fact that since they are hardworking folks, they may be younger patients that require higher demand implants that are going to last them a longer amount of time than, say, someone who's not as active, and their joints may wear out later in life, say in their 70s or 80s, but we're going to see some young men and women maybe in their 40s and 50s, and they're going to require the necessary high-demand implants that their surgeons are asking for to make sure that it lasts for as long as they need it to last for.
Yeah, that's a good observation.
Yeah.
That was what I was trying to formulate in my mind with the question. That's really what I was looking for. Yes, probably you're going to get younger people that need implants that last for a longer period of time.
Absolutely. We just had a young man stop by the booth, and unfortunately he was just chasing a cow, felt something pop. He needed medical care, and now he may require a surgery depending upon how his bone heals up in his knee, and that's why he's going to the orthopedic specialist to make sure. I mean, hopefully not surgery, but if that's what needs to happen to make him get back to his production, then that's what's got to happen.
Okay.
Yeah.
Talk about the non-surgical aspect of what they do at the surgical center. Things beyond surgery. I would assume that the physical therapy has got to be a pretty big part of what you do.
Yeah, so that goes a little bit beyond our spectrum, being on the industry side and on the implant side, but there's a whole gambit of PT and different non-operative treatments, specifically with the orthopedic group in town that is part of the surgical center continuum of care, and they would be able to provide a lot more options for non-operative care, kind of outside of the realm of what we would see done at the surgical center.
Educate me here a little bit. When you say implants, what are we talking about?
So it's the actual prosthesis that implant the ball and socket joint in the hip, or on the knee, the implant the femoral component in the tibia that make up the knee joint. So we're the company that creates those implants to go into the patient that the surgeon utilizes.
I'm going to give you a chance to just tell me something that I probably don't know, and I don't know much, but something that you think is really interesting about your field that the layman would not know, that you wish that they did. Or maybe that would just make them go, wow.
Well, I guess what we're here for is this Mako robot.
Okay.
And this is our newest technology in orthopedics. And so what this does is this allows the surgeon to control the robot, but with a CT scan preoperatively, gathering of points intraoperatively. Once the plan is approved by the physician, by the surgeon in the OR, this will, as accurately as possible in the industry today, allow them to put in the implant the way they want to do it to hopefully, again, increase the longevity of the implant and to make it a long ways down the road before we have to see any revisions or any other surgeries for that patient, because as nice as it is to get it done, it's not that much fun to have it done, I don't believe. So, it's accurate to within a millimeter, and so whatever plan that they put in place that the surgeon, again, is still fully in control of, this will implement it. It will help the surgeon implement it as best as possible, and any outliers that were out there before are really condensed now. So there are still other factors that may contribute to a revision surgery sooner than later, but hopefully it's not the implants failing.
Right.
Yeah.
What a great blessing.
Absolutely. Yep.
Yeah.
And the surgeons are all fully trained on it, whether it's hip, knee, partial knee. They have a day of training, work on cadavers, and make sure that they are fully in control of the robot all the time. So, yep.
Different kind of tractor.
Absolutely. Different kind of tractor, right. You got that right. Great. Thank you.
I don't believe I've ever had this joke filmed before. Okay, so there's a guy driving along and he sees a sign in a farmhouse window that says talking dog for sale. And he's got a little time in his hands, so he looks around and he parks in front of the farmhouse and he knocks on the door, and the farmer answers the door. He says, I saw your sign. You've actually got a talking dog? The farmer says, yeah, you want to take a look? The guy says, absolutely. So the farmer leads him through the house out to the back porch, and there's a dog laying there. Just a man looking down at the dog. And the guy's looking at the dog, and the dog's looking at the guy, and the guy says, so you talk, huh? The dog says, yep. The guy says, well, I'm interested. I'd like to hear your story. The dog says, well, as you might imagine, my special abilities were spotted when I was pretty young. Just a puppy, really. The government got a hold of me, so I did special ops work. Got to see a lot of the world that way. Pretty interesting. Then I was transitioned to airport security. And you see, most people thought that I was a drug-sniffing dog, but in fact, what I would do is use my superior hearing to eavesdrop on conversations, and then my verbal abilities to report on possible terrorist activity to my superiors. But then I hit the mandatory retirement age for dogs, and, well, that's how I ended up here at the farm. But I still get to thinking I got a few miles left in my tank, and that's why I'm looking for my next opportunity. He says, wow, fascinating. I'm going to go talk to the farmer. So he goes and talks to the farmer. He says, how much you want for that dog? The farmer says, $20. The guy says, really? For a dog like that? Why so cheap? He says, well, hate to tell you this, mister, but that dog's a goddamn liar. He never did any of that shit.